all. Welcome to the first session of the Spotlight series. This series is a part of Behavioral Conference 2026, a behavioral science conference happening from 12th to 14th February in Christ University, Bangalore, India. I am Ashley Sibi, and I'll be your host for today. Our speaker is Emiliano Díaz del Valle, a behavioral economist with over 15 years of experience applying behavioral science to complex challenges throughout Latin America. In his current role as Director of Projects for Latin America at the Busara Center for Behavioral Economics, he has co-developed pioneering methodologies for systemic behavioral analysis, addressing issues related to financial inclusion, gender-based violence, and social development. Today, Emiliano will be discussing the topic from nudges to systems, behavioral science for real-world complexity in the global south. With great pleasure, I invite Emiliano to share his diverse experiences and insights.
Perfect. Thank you. Thank you, Ashley. Thank you, everyone, for being here. I'm going to briefly talk to you about how Busara is applying a behavioral systems approach and how this, let's say, differs from the regular behavioral or applied behavioral science approach that we used to do before. No? Just a brief introduction so everyone knows who we are. Busara is an applied global firm who's focused on tackling, let's say, poverty in the global south. No, one of the particularities of Busara, no, is that we not only focus on development, we focus in development below this orange line. No, one of the particularities again of Busara is that 95% of our teams are born or raised below this orange line. So most of us have been working in the global south or living in the global south for a while, and we tend to use that experience to help us tackle the projects. No, Busara has around 10 years of experience working, so we've done a lot of work in various places in the global south. No, and just to summarize, what kind of work do we actually do? No, Busara has a focus on always applying a behavioral lens to understand and eventually implement something that we can test. No, for example, right now we are developing a project related to food choices in the Caribbean. So basically, we designed an intervention that we're testing through an RCT structure, not to understand whether the insights and the elements that drove our redesigns or our interventions actually facilitate better choices for parents. No? We also do a lot of evaluations, and this is important because you can see that most of our work tries to end up having some sort of impact that we can measure. And this is very important because this idea of having an intervention idea that we can actually test has driven a lot of what we tend to do. No? I would say that for the last 5 years, this question that is in the screen right now has driven our way of approaching behavioral science. No, we're constantly thinking, how can we design and sustain behavior change in contexts where social, structural, and economic barriers are not only complex, but unpredictably and deeply intertwined, as it's often the case on our countries on the global south. No, so by thinking about this and by collectively looking at the various projects that we had in geographies like Latin America, East Africa, or even India, no? We eventually developed what we call our behavioral systems methodology. This is fully and freely available in our website. No, if you go and search behavioral systems Busara, you will be able to access this link and download the free methodology. No? The methodology basically is a way of shying a little bit away of the regular way of approaching behavioral science, but with the goal of making it better. And how does this work, or how does this look like? No? When we do regular applied behavioral science, we tend to look at issues in a two-dimensional way, let's say. No, we tend to look at the behavior and a chain of actions, let's say, that affect or are related in the execution of that behavior, and we tend to identify elements like barriers, perceptions, expectations, and things that eventually turn into abandonment points and good leverage points that we can use. No? So this is the regular way of doing behavioral science, which is not bad. No? This on its own is a really good way of approaching an issue and trying to understand how to optimize. However, when we look at this kind of focus or application in a more let's say, down-to-earth example, no, we'll realize this approach has certain flaws. And we can think of this as one day you come in the morning, you're going to shower, you open your shower, and you realize that the pressure in the shower is really bad. So you're tired of having to shower with so little water, and you just want to have a comfortable shower. So you basically look, and this is the interesting thing. If you look at this issue linearly, let's say, you will say, okay, then there's an issue in the shower head which is affecting the pressure. So if I change the shower head, no, things should solve it themselves. No, however, then you go change the shower head and realize that even though the experience improved slightly, the issues of the pressure in the shower still exist. No? And this is what tends to happen with a lot of our interventions. No? We tend to isolate things, analyze things, let's say in a petri dish, find these linear relations, and eventually intervene and find something that works under a controlled environment. But then when you take this out of this controlled environment, things don't work as we expect them to. And this is why we realized, okay, we need to grow a little bit this focus of only joining or of only looking at the behavior linearly. And we need to understand that this behavior lives within a context, lives within a system that has things that affect this path that cannot be necessarily seen directly linked to this path, but that will eventually have some effect. And this means trying to look a little bit outside the box and trying to understand this path connected to other things that are not directly related, like actors that might not affect this path, but are relevant to things that happen in the path. Policies, protocols, other related behavioral paths, and things that we might not be directly seeing in the path or in the issue that we're looking at, but that we know, and as we take them as part of the context, this become an issue or part of the issue. This means that we shouldn't look at the issue of the shower head as something that we just linearly go change the shower head and solve the problem. But we should think of this as a systemic, let's say, issue, where we look into pressure, we look into leaks, we look into the pressure of the water that comes from the public service to our home, and things that eventually we might not be able to see in the shower, but are affecting the whole system that allows the shower head to have the proper pressure. The whole idea of behavioral systems is this, to basically go out of the petri dish and look into the whole thing as a living element that we can then understand, okay, how we should look into the issue and how can we foresee, let's say, that some regular approaches that would work, let's say, in a controlled environment would not work in an issue like this. I mean, you can change the shower head, but if you have a leak that is basically taking all the pressure from the system, you won't be able to have a comfortable shower until you look into those other issues. Which is this, no? You start looking into the plumbing and you realize there might be some other issues that are not obvious, but that are affecting the conditions that allow that journey that you're looking into to work. And this is just a very simple way of thinking of this issue, because if you're looking into this, you start realizing, okay, it's not only about the shower head, it's about the whole system of water that provides pressure to that shower head. And you realize that this can also create some other kind of relations and issues that you might not be looking at, but that might be relevant if you really want to solve the issue. So taking this back a little bit to more the kind of work that we do, no? In 2023, we had the opportunity of working in a very interesting project in Guatemala. In this case, the Guatemalan government and an NGO that was working in Guatemala at that time came to us asking, how can we better design the service provision for victims of gender-based violence in order to allow them to actually get the support that they need. But when we got that request, we realized, okay, we cannot really think of this only as an issue of the system and the service provision, because that would be looking at the issue as a two-dimensional thing. We want to improve the number of victims that receive support, let's improve the process, no? Which obviously makes sense. But then we realized, okay, if we do want to actually make a change and actually create something that allows us to tackle such complex issue, we need to think broader, not only in the journey map. So we started thinking about how can we identify policies, protocols, and interventions that, when effectively implemented, can enable the health system to enhance the support that they provide to victims of gender-based violence. So this is where the methodology kind of kicks in, and I'm just gonna summarize it really quickly because this is quite complex. Now you can, again, go and look it in the webpage, you realize that it has a lot of substance in it. But we're just going to briefly walk over how did we deploy this methodology. So initially, the methodology forces us to look into the system, understand what is actually creating the conditions for things to work the way they are working in the system. So for this, we basically went into the field and conducted a regular, let's say, behavioral research. You know, we went into the field, we basically went and visited sexual violence clinics. We talked with people from the ministry, we talked with doctors, frontline workers, NGO representatives, people that were researching the topic of gender-based violence, and we did that in three different locations. We started in Guatemala City, which is the capital of Guatemala, but then we went out to more rural areas like Ichemo, Huehuetenango, to get a different sense of what was actually the system looking like outside of the capital city. You know? We conducted a series of qualitative analysis. Now we had some in-depth interviews followed by some social focus group discussions. We went to the field and followed people going to seek support. We went to the clinics and talked with the doctors. We basically tried to understand various levels of the system. And this allowed us to start understanding not only the path that the victim has to go through in order to seek support, but other things. Things like the culture of impunity around GBV in Guatemala and the effects of this culture of impunity. Things like the number of victims that were actually being reported. And as we started analyzing this, we started realizing that the journey was connected or was, let's say, surrounded by things that did not affect the journey directly per se, but affected the whole system. No? So as we started gathering more insights and gathering more understanding of the system started to change and started to get more and more complex because we realized, okay, there are a lot of players in the system. The doctors have a role, the policymakers have a role, the frontline workers have a role, the community authorities have a role, and there are a lot of things that affect the decision of whether a victim wants to go and seek support or not. And we realized that even from before connecting with the health system, there were a lot of things in the family circle that were affecting the wellness, let's say, of the victims. Eventually, the map became too complex for us to comprehend. So what we started to do, and this is something very interesting about this approach, naturally, as you start thinking about the whole system, you start understanding there are a lot of more things that we initially thought of affecting this. But how can we make sense of all this complexity? And this is where the second stage of the methodology kicks in and gives us the tools to actually do this. As we realize that the system is way more complex than we initially envisioned, and as we realized that we were not going to be able to do a qualitative analysis of the map with success, no, we started turning the map into an agent-based model. So what we extracted from the map was a series of decision functions. Now, what are the choices that the victim has to make in the process of seeking support, and what are the elements that affect positively or negatively these choices? What are the actions that they need to take, and what are the elements that affect positively or negatively these actions? And what are the elements that, let's say, depict different elements or different conditions between the actors? As we map these things and as we turn this into an agent-based model, we started having the chance to create simulations with the model. Because as the model basically replicated what we understood of the system. What choices did the people make? What elements or steps did they have to go through? And what were the results of actually achieving certain outcomes on the system? This basically gave us kind of a path, a path with certain rates and possibilities, that triggered depending on the person's demographics, if they were close to the hospital or not, if they were in Quechén or Huehuetenango, if they were a male, a women, an indigenous women, and things obviously changed, the way the system reacted to these people changed, and the way that the outcomes were obtained also changed a lot. With the model, once we had the model, we sat down with the people, we validated the model with them, we made sure that the model was actually doing or representing the things that the people in the context were seeing. And once we had that, we had the chance to start simulating what would happen if we changed the system. Let's say by this moment, the agent-based model basically gives us a box. And with that box, we were able to say what happens, for example, if we plug in twice the amount of energy into the box. What if we change the temperature of the box? What if we change the cables that we use for the box? And basically, as we turned this into the project, we started changing things like, well, what happens if instead of an indigenous woman reaching the hospital and not finding a local interpreter, hence not being able to get the support that they need, what happens if we implement a policy that allow or that forces or creates the possibility that there's an interpreter in every single sexual violence clinic hospital? And then we realize, okay, this allows the victim to actually go into the second, third, or even the fourth step of support. And then we started changing things like, well, what happens if we supply the rape kits that are needed in this first and the second level hospitals? Or what happens if we teach response strategies? Or what happens if we do this and that? And this was very important because these kind of simulations, if we instead of doing simulations try to actually go and do an RCT to measure whether providing local interpreters was going to work or not, would be either very costly, very slow, or the most important thing. Many of these things, if we wanted to test them in the field, will bring us into very sensitive ethical concerns because we will be holding services for people that we know that they need them just to get a result on whether this is actually working or not. So we wanted to avoid all those issues. So the simulations allowed us to kind of do this without falling into these problems and ethical concerns. The simulations basically gave us this. What you can see in the screen is the results, the well-being results of various interventions. The one on the left, for example, is a simulation of what happens if we create programs or change programs that are currently teaching elements on GBV to actually teach how to expect and deal with retaliation, for example. Or what happens if we implement a mandatory screening for violence in every hospital in Guatemala. And this is where things started getting interesting because the graph on the right basically brought us into a really weird situation. Why? We were basically simulating what happens if we implement a mandatory screening process for every single person, that women mainly, that comes into the hospital. No matter what they tell us, if they are here because they have a belly ache or something, no, we have a triage to understand whether this person is actually here because of gender-based violence or not. Internationally, that's a very well recommended practice. You should implement mandatory screening. However, in our results, this was actually creating more harm than good. And initially, we thought this was an issue with the model, and we ran the model again, and we realized, no, this is not an issue with the model. What this was actually helping us understand was not only what we would be prioritizing and pursuing when designing behavioral interventions, because we knew there are certain things that will actually create good over harm. But the most important thing is we were able to uncover non-obvious effects and non-obvious feedback loops that were actually affecting negatively the whole system and decaying, let's say, the system eventually. Coming back to the mandatory screening process, no, mandatory screening process is not a bad implementation or a bad policy per se. It's actually, again, an internationally well recommended practice. However, in the conditions that we found in Guatemala, where victims were not accessing anonymized ways of reporting, and most of the times any report would circle back to the perpetrator. No? So this was the reality. Most of the really small communities in Guatemala, and others are an indigenous community most of the times. And in this situation, the indigenous community tends to deal with these cases. Unfortunately, many of the times when this happens, the authorities, instead of dealing with the issue, they basically inform the perpetrator that they have been accused, which triggers a very rapid response and a lot of violence on retaliation to the victim. So again, no, it's not that screening for violence is bad. It's that creating a policy that implements this without ensuring confidentiality or safeguards against retaliation will actually create more harm than good. And at the end, we identified these non-obvious effects that, unfortunately, basically feedback into the system and create less and less resistance for the regular kind of interventions for that we want them to work. No, so ideally, if we don't cut or destroy these negative feedback loops in the system. No, any kind of intervention that we try to make will probably suffer, no, on the conditions already created by this negative feedback loop. No? In the end, what we do with this is we understand, okay, there are certain things and certain paths that will allow you to trigger, let's say, the system and find the initial returns and get the results that you want. In this case, we realized that there were 6 leverage points that we needed to implement initially. We needed to ensure confidential reporting. We needed to ensure programs related to GBV education and retaliation strategies. We needed to implement elements to denormalize the GBV in certain parts in Guatemala and other things. But we also understood things that would not create the impact that we expected until we created these first conditions. And the most importantly, is we were able to identify things like the mandatory reporting that was about to implement. And this is very interesting because without looking into the system, Guatemala was being pushed at the time to increase the number of data that they have regarding gender-based violence. So the natural response from them was, okay, I need to increase the data that I have in order to reach international status and be able to trigger some loads. No? Okay, then we need to implement mandatory reporting. No, it's like a logical, linear way of thinking. You need this, then increase the reporting. But when we looked into the system results and when we were able to connect this with the people in the field, we realized that we were actually able to sit down with the government and discuss the idea, no, of removing this mandatory process and prioritizing the implementation, sorry, of a mandatory of an anonymized reporting process. No? At the end, the idea with this process is that you end up understanding why and how you can intervene the system to create actual better results for the system. And this is kind of a way to think of coming back into this initial idea of the plumbing system that we started with. It's like going back into this whole plumbing system and understanding, okay, I need to change the pump. I need to change this part of the tube. I need to change this connector. I need to change the shower handle. I need to change this and that in order to create the conditions for this to work. It is kind of a way to deal with complexity. It is complex by nature, no? But thinking of what we said at the very beginning, no? If we're in such complex position of dealing with things that are not always as we expect them to, dealing with infrastructure issues, systemic things that affect the behaviors that we're working with, turning a shy eye to these systemic elements just doesn't make any sense to us. No? Now, how can you learn more? This topic and this direction that behavioral science is taking is gaining a lot of strength recently. For example, we started publishing this methodology around 2024. At the start of the year 2024, then you'll be able to find some other documents. For example, the European Commission released something earlier last year. No, there are a couple of documents by the OECD, things that are also, let's say, references that will allow you to continue understanding how the systems approach can help us think about ways to tackle the issues, social issues that we work with. But you don't need to go into all the extent of going and immersing fully into the methodology. If you're able to do it, that's great. And I think that's the best way that you can actually connect these two things. But there are other ways that you can also bring in this systemic thinking approach into what you do. For example, the socio-ecological model or this idea of an onion map is a very simple way of approaching a systems thinking way of seeing things. No, here, for example, you start having different layers of the onion and you start thinking of different levels, let's say, of the system. Not only the people that might be directly connected to the behavior that you're working with, but you start understanding what does the community think, what does the government space think, what are the policies that support or affect this, and what are the structural, or in this case, the nature elements that will also be taken into consideration. This is a very simple approach, but you can also use, for example, Ruth Schmidt choice triad approach, which is a very elegant way of integrating a systems view to this. Ruth, for example, basically isolates three things to summarize the systemic things that affect the context. The first one is the choice posture, no, which obviously thinks of the perceptions, the experience, the individual context that people have, no, the choice architecture that the people face, and the choice infrastructure that surrounds the conditions that allow or not the person to perform a certain behavior. These more simple ways of bringing systems thinking to what we do is also a really interesting way of, let's say, shying away from this linear thinking. No, by thinking linearly, we're basically looking from Ruth's perspective. No, we're basically looking only into the choice architecture element of the system. No, and we need to include these other two. Again, if you can go and perform the full methodology, that would be great, and that will give you a full depth, the full depth of the insights that you can get. But just by simply thinking about not only what we can see and interact with, but what are the elements outside this context that also affect this, no, will start opening our eyes and allowing us to look.